everyone. Good morning, it's great to be here. The field in which we work is a dynamic field with science behind immunisation evolving and advancing all the time. And we hope our conversation today is both informative and useful to you. My name's Chris and this is Angela.
Hi.
Vaccination is one of the most effective ways to prevent diseases. A vaccine helps our body's immune system recognise and fight pathogens like viruses and bacteria, which then keeps us safe from the diseases that they cause. And vaccines protect us against about 25 debilitating diseases, including measles and polio, tetanus, diphtheria, meningitis, hepatitis, and cancers caused by the human papillomavirus. We're registered nurses who are accredited in immunisation and with about 40 years of experience in nursing overseas, in working overseas hospitals, working in general practice and in community settings. And we're both advocates of preventative health. So we're here to share some information today and create awareness around immunisation. It's a dynamic field and has changed a lot since you were vaccinated as children. We are a commissioned organisation by the Adelaide Primary Health Network to provide support and resources to increase the immunisation awareness and to offer activities that improve health literacy around immunisation. So what we're going to cover today is really just a bit of introduction to the Australian immunisation schedule and for the recommended immunisations for all age groups today. So the World Health Organisation also states that currently immunisation prevents 2 to 3 million deaths every year in all age groups from diseases like diphtheria, tetanus, whooping cough and influenza and measles. So it's one of the most successful and cost-effective public health initiatives. So an additional 1.5 million deaths could be avoided if we can raise our immunisation rates. Thanks, Ange.
So now I'm coming to our halo. So with that, you ask in regards to our health, our age, our lifestyle and occupation. So with our health, we have here is extra vaccinations may be required, but for people with conditions such as asthma, diabetes, or heart conditions like lung and kidney, spleen conditions where the immune system may be compromised. Our age, the schedule of vaccinations is designed to take into account the best time to get protected against certain diseases. As we age, our immune system becomes less effective at protecting us from disease, meaning we become more prone to catching infections, and once we catch an infection it takes us longer to recover. Then our lifestyle is how we make our choices in life impact on our need in immunisation, such as travelling overseas, playing contact sports, becoming grandparents, hobbies, smoking and some types of sexual activities. With our occupation, this may some jobs with greater exposure to disease. If you're unvaccinated, you could be exposing yourself and vulnerable people around you for infectious vaccine preventable diseases. Many of the vaccines listed on the Immunisation for Life poster are provided free by the Australian government to Medicare card holders. Some vaccines need to be purchased on prescription. These may be covered by your private health fund. Check your fund. Vaccine requirements differ sometimes from one country to another, and this is because there are different patterns of disease. The experts in each country decide what's best for their populations.
Right, so now let's talk about some childhood immunisations. So the vaccinations that we're going to talk about now are recommended for your baby and children. However, unfortunately, with people without a Medicare card, there will be a cost involved for these vaccinations. So when do I get my child immunised? Shortly after birth, when your baby is in hospital, a hepatitis B is given. Babies need to have this first hepatitis B vaccination at birth because it is possible for a mother to have hepatitis B and pass it on to her baby without actually knowing that she's got it. But then when your baby is 6 to 8 weeks of age, this is the time to visit your general practice or immunisation provider. And we've got some clinic flyers here that this is what you might be looking for if you're going to a public immunisation clinic that's provided by your local council. So you need to also remember to bring along your baby book, which is given to you in the hospital, or any other immunisation records that you may have for your children if you're from overseas. Your doctor and nurse will at first do a health check and ask a series of questions about you and your baby. They'll ask you also if you have any questions for them. Following the vaccinations, a nurse will provide you with some detailed information about the possible side effects and management of these vaccines. So, for example, some of your babies may have some soreness or redness at the site of the injection, perhaps a little bit of unsettledness. Some babies who have a little bit of diarrhoea and vomiting, and some may just get a little fever. So that Panadol is the best remedy for that. You'll need to wait 15 minutes after your vaccination while the doctor and nurse can keep a close eye on you in that time. And during that time, they will register your child's immunisations onto the Australian Immunisation Register. Most vaccinations, unfortunately, are given by needles, but the first and second visits, your baby will also receive an oral vaccination, the rotavirus vaccine. And these are a few sticky drops of fluid that they give in the baby's mouth. And this is all to start protecting your baby against these vaccine-preventable diseases. In South Australia, though, we also recommend that babies receive the meningococcal B vaccine, and that's given at the first and second visits, and then again at 12 months of age. So once your baby has reached 4 months of age, you'll need to bring the baby back to your doctor or immunisation provider, where the same vaccinations that they've had at the first visit will be given to help build your protection. At 6 months, there's only one needle, and this is the first opportunity for your baby to receive the influenza vaccine that's highly recommended each year and can safely be given with other scheduled vaccines. Most doctors and nurses during the vaccinations will encourage you to hold your baby, though if you do find it distressing, ask a support person or another staff member to hold the baby. And we're just giving a demonstration of how you hold the baby. So the vaccinations at 6 months, at 6 weeks, 4 months, and 6 months of age will be given in the top of the leg on both sides. So once the 6-month vaccinations are over, you've now got a 6-month break before baby's next vaccines are due at the 12-month age bracket. So at this visit, there'll be 4 needles, one for the pneumococcal, one for measles, mumps, rubella, one for the meningococcal ACWY and the meningococcal B. And some parents can feel quite concerned about the number of injections given at one time. But the expert medical advice is that this is the best time to protect your baby, and it's medically very safe to offer these vaccines, as baby is dealing with thousands of germs every day. So to make it easier for you, cuddling your baby, letting them suck on a dummy, both help to relieve the pain on babies. You can also use a distraction like a rattle or a toy, or even a visual device such as a telephone with a nice music playing is also another, helps to settle them more quickly. In another 6 months, when your baby's 18 months of age and very cute and curious, we have 3 more needles for them, and this time a chickenpox is going to be included with those vaccines. And now you earn a really well-deserved break, because the next vaccines are not due until the baby's 4 years of age. And then it's just the one, in most cases, it's just the one vaccine. We do also have to let you know that some children with certain medical conditions may require other vaccinations at the time. So well done. You've helped protect your baby against serious vaccine preventable diseases.
But wait, there is more to our story. So when your child reaches year 8 and in year 10 at school, they'll be offered vaccinations, a form like these will go home to the parents or legal guardians, and they need to be to complete the consent form. They also need to be returned. This is very important, because even if you do not consent to the vaccinations, they need to be returned to the school. If you need assistance with this, you can speak to your local Australian Refugee Association or a health advisor in regards to completing the forms. So in year 8, the child will receive the human papillomavirus vaccine, Gardasil.
Oh,
There,
yeah,
yep.
this one.
And and also Boostrix, which is for diphtheria, tetanus and pertussis for whooping cough. In year 10, vaccines, meningococcal ACWY will be given, as well as the meningococcal B, and these are recommended. The nurse will attend the school twice during the school year. If your child misses those school visits, there are clinics that they can catch those vaccinations up at. The vaccinations are to protect your child against diseases that, although rare, can cause serious health conditions later in life. These health conditions, such as cancers, blood poisoning, inflammation of the lining of the brain that lead to loss of limbs, and other ongoing health problems through their life. There is no cure for these diseases. As in 2019, 12,025 cases of whooping cough were reported nationally. Children under 15 years of age accounted for 53% of the whooping cough notifications. So then, in the following days from having the vaccinations at school, few students may complain of common reactions such as redness, soreness at the side of the injection site, fever, nausea, headache, muscle aches. They will recover from these symptoms within a few days. A record card that was just shown, that will be given to the child and after vaccination to take home to the parent and caregiver as a record of vaccination, and the possible side effects, including contact details if you have any questions.
Also, if you're under 20 years of age and hold a Medicare card and think you may have missed out on some of the childhood or school vaccinations, please contact us at HAMES directly or through the Australian Refugee Association for advice about your free catch-up. So now moving on to the adult vaccinations. We'll start with if you're pregnant or you know someone who is, remind them that it's free to have a tetanus, diphtheria, whooping cough vaccination when they reach 20 weeks or halfway through their pregnancy. This is to protect mum and the child from tetanus and diphtheria, but most importantly from whooping cough, a disease that can cause really severe sickness and even death to a newborn baby, even when hospitalised. And 4 out of 5 babies with whooping cough actually catch it from somebody that they know at home. Close family members are recommended also to have this vaccine to help them protect the newborn baby. The doctor will also ask you about having a flu shot. in your pregnancy, which can potentially be very serious for you and your unborn child. This vaccination protects you during your pregnancy and the early months of motherhood. It also protects your baby through transplacental antibodies and antibodies that are also present in your breast milk from having the vaccine. There are many occupations, as we discussed earlier, where vaccinations are necessary because of the nature of your work. So we could think about dentists and plumbers, childcare workers, for example, could all be exposed to diseases, and you could unknowingly infect people in your care. And when we reach 65, there are other vaccinations that are highly recommended, including the influenza. There's also pneumococcal vaccines, shingles vaccine. These help to protect you against diseases that cause people to be hospitalised and endure long stretches of being unwell. At 70 years of age, it's recommended that you all receive a pneumococcal vaccination, and this prevents severe chest infections caused by the bacteria. And it can also cause encephalitis, which is swelling of the brain. There's a vaccine for shingles at 70 years of age, and that's a reactivation of the chickenpox virus and can be absolutely debilitating. Can cause severe pain for protracted lengths of time, tiredness, depression, losing contact with the world around you. In fact, 20 to 30% of people will develop shingles in their lifetime. Evidence also demonstrates that with the influenza vaccination, in patients with diabetes, significantly it reduces their flu and flu-related hospitalisations. We know now that influenza vaccine almost halves the risk of heart attacks. And free influenza is available for 65-year-olds and over who have a Medicare card. The reasons behind why vaccinations are recommended is both to reduce your chance of contracting the vaccine-preventable diseases, but it also protects our community. It's called herd immunity. When enough people are vaccinated, the disease finds it harder to spread through our communities, and that helps prevent the spread of disease to someone more vulnerable, i.e. your new grandchild, a sick relative or friend, or someone who can't be immunised.
So the Australian Immunisation Register, from the 1st of October 2016, the ACIR, the Australian Childhood Immunisation Register, expanded to become the Australian Immunisation Register, a national register that records immunisation given to people of all ages in Australia. Vaccinations given before this date will not appear here unless you have supplied records and requested an immunisation provider to record on the Australian Immunisation Register. Speak with your immunisation provider to have your records updated on the register. This can be accessed through the MyGov account, My Health Record, or Express Plus Medicare mobile app, or your phone the Australian Immunisation Register on 1800 653 809. So that's there. So all immunisations are recorded on the Australian Immunisation Register.
So in summing up, we understand that it can be hard to make some sense of all the available information about vaccination, but hopefully we have made things a little clearer for you today. Remember that vaccination is the best way to protect yourself and your loved ones from serious infectious diseases. If you want to discuss your concerns, make sure you talk to your doctor or your immunisation provider. Thank you very much.
Thank you.
Thanks.